Hi everyone, and welcome to this month's Kinetic Health Wellness webinar. My name is Andrea Hickel, and I'm a licensed clinical social worker.
And I'm Jordan Shireen. I am a registered nurse with Apex Benefits, and we are excited to talk with you guys today about heart health and how it is more than just physical health, how our mental health plays into it. So we're excited to dive into that today and discuss it. Andrea, you want to go into some of the webinar housekeeping first?
Yeah, for sure. So I'm just going to go over some housekeeping with the GoToWebinar platform so you guys are aware. Just so you know, all attendees are going to be in listen-only mode, so you will be muted. If you have any questions or comments throughout the presentation, we would love to hear them. You can use the chat box located in the right-hand side of the webinar screen. We do have our lovely coworker Kelsey in the room with us, and she'll be monitoring the chat and letting us know of any questions or comments that you guys might have throughout the presentation. For audio access, if you are accessing this just via phone, there is an option for dial-in only, and you can use that as well, or your computer audio if you are on the computer. And then finally, you guys will have access to this presentation, the slide deck, as well as some additional resources, and they can be downloaded by clicking the icon on the right-hand side of your webinar screen.
All right, so our agenda for today, we're going to dive into what heart disease is, identify risk factors for developing heart disease, review the link between mental health and heart health. We'll discover kind of what that is, and then identify healthy coping strategies for stress. Now, before we get started, we're going to get you guys involved a little bit here and ask you a couple of questions. So first off, we are going to ask you, stress produces what type of changes in the body? So that'll be increase in heart rate, increase in blood pressure, immune system changes, or all of the above. So we'll give you a second to go ahead and answer that.
See what people think.
You might be in a group, so there might be some group discussions.
Yeah, group discussions.
We
might have some different thoughts. Okay, so we're getting some engagement. It looks like most people are saying all of the above. What do you, is that right, Jordan?
That's correct. So yeah, stress produces increased heart rate, increased blood pressure, and immune system changes. It actually decreases your immunity and makes you more susceptible to some infections and colds and whatnot. So good job, guys. We've got one more for you. This is going to be a little personal, but where would you say you are experiencing the most stress in your life right now? So we have the workplace, home, or your personal life. This is kind of more mental health, anything like that, or a combination of all of the above. So go ahead and answer that to the best of your ability. I know for me, it would be probably a variety.
Yeah, I was gonna say it'd be a mix for me. I feel like it's not that, linear, but
it depends on the time of year too.
For sure.
Okay, a lot of workplace and home.
Okay. So combination, some all of the above. Yeah.
Great.
That's all normal, guys.
A lot of variety. Well, thank you guys so much for participating in that. Just helps us to get an idea of and discussing with you guys as our audience as we dive into these topics today. So February, we are ending February for you talking about American Heart Month, right? And I know you've heard a lot about this. You probably had some wear red days at the office. As you can see, me and Andrea went a little more business casual today wearing some hearts. But we know that our hearts are really important. They carry oxygen, they carry nutrients, hormones, and cells all throughout our bodies. And when they work harder than they need to, that's going to be when they are more susceptible to something called heart disease. Heart disease sounds really general. I remember learning about it and being like, okay, what exactly is that? And it's actually going to be a broad kind of umbrella, if you will, of covering different heart chronic disease processes. So that can be heart failure, cardiomyopathies, coronary artery disease. All of those are going to fall under heart disease. And unfortunately, many of these conditions are often kind of silent as they're growing, as they're getting more chronic. So we don't often know that we have them until it's a little later. We may experience like a heart attack or a stroke, and it's dangerous. We need to know about these things ahead of time. So heart disease is a very prevalent issue that we need to be aware of. And we actually know that it is the leading cause of death in the United States, which is actually more than any of the cancers combined. So this is a very prevalent issue, which is why we want to talk about it with you guys today. So you may be asking, okay, who's at risk for heart disease? Like, let me know, I want to discuss this. And there are a lot of different risk factors, unfortunately. A few of the highest are going to be those with high blood pressure, which is also known as hypertension, high cholesterol, which is also known as hyperlipidemia, if you've ever heard your doctor say that, and then any use of nicotine. Now, surprisingly, nearly half of the US has at least one of these risk factors, and that is not counting the individuals who may have more than one of those risk factors. So we like to discuss this because, again, the signs and symptoms of high cholesterol and high blood pressure are going to be more silent. So you're going to hear me say in my regular nurse way of going to your primary care provider is going to be one of the most important things that you can do to assess these risk factors so that you can see if your blood pressure is starting to increase, to discuss medications that you may need, or your cholesterol as well. And unfortunately, we can't often tell what those lab values are unless we get blood drawn and go to our primary care providers. The other most controllable risk factor for heart disease is going to be smoking and nicotine use. Now, we do not downplay the fact that smoking, especially depending on how long maybe you've used it, is a very difficult thing to cut back on or quit. I will say though, cutting smoking out of your life completely though actually decreases your risk for heart disease in half, which other than, I mean, everything else does not have that significant of an impact. So nicotine use is going to be one of those things that we say is one of the top controllable factors. And we want to make sure that you understand that as well. So have those good, honest conversations with your primary care provider about your readiness to quit or to cut back, and discuss what programs may be available to you to get that started. But there is a growing belief that another risk factor is a big part of our heart health, and that is going to be stress, which leads us to our topic today. So stress is going to be a big risk factor to our heart health. And we know that everyone experiences stress throughout their days. I mean, it just kind of depends how your day goes, maybe at work or home. And we're not talking about those isolated stressful events. I'm more talking about that stress that lasts for a few days. It lasts for a few weeks. It's starting to get chronic, and we need to maybe talk about some coping factors. Because like we discussed in the first polling question, that stress increases your heart rate and it increases your blood pressure. And when you are in that state for a consistent amount of time, then you are at more risk to developing hypertension, heart disease, high cholesterol. And people with, ongoing stress, any diagnosed condition like anxiety or depression, they actually have a 40% higher risk of developing heart disease. And unfortunately, that can often just be because when we're in those anxious states, when we're depressed, our coping mechanisms are not going to be as sharp usually as maybe they would be if we felt in a better mental health space. We might be eating poorly, we're not moving around as much or exercising, taking our prescribed medication. Maybe we're smoking a little bit more, or we're having more stomach pain because of what we're ingesting. There are so many different things that can play into that. So that's why we have Andrea to kind of dive into those different coping mechanisms we wanted us to discuss, because it affects your heart in the long run. So Andrea, can you kind of dive into that? Give us some helpful steps of how to control it.
For sure. Thanks, Jordan. And just as Jordan said, it's so linked. You know, our mental and our physical health are so linked, and so our heart health is no exception to that. And stress is a big risk factor when it comes to our heart health. So I'm going to talk with you guys a little bit about how we can take some preventative measures when it comes to stress management, as well as how can we cope when we're dealing with chronic stress. What are some things that can help lessen that risk, okay? So the first thing I want to go over with you guys is what I like to call the 4 A's of stress relief. This is just an easy thing that you can remember to kind of walk yourself through as you're going through maybe some stressful events, trying to figure out how to navigate stressful situations. What are some things you can do to help maybe prevent that stress or lessen that stress when you're going through it? So the first A there is avoid. As Jordan said, there are some stressors that we just can't avoid, right? They're a part of life, but there are some things that we can avoid. And part of that is knowing what our triggers are. What are our trigger places, our trigger people maybe? What are some things that maybe just heighten our stress? And that's going to take just knowing yourself, knowing what some of those hot button things are. And can I avoid those things if at all possible? And if I can't, that's going to be my first line of defense, right? But in the instances of stress that you can't avoid, the next thing to do is really kind of come to that acceptance piece of accepting that stress is a part of life. And sometimes we are going to have some ongoing chronic stressors, and we need to find a way to then alter or adapt to those stressors. So moving on to our other two A's of, how can we maybe alter a situation or something that we know is going to be stressful? Maybe we have identified that that's a trigger. We're going to go into it being, proactive, and we're going to maybe enlist some supports at a stressful event. Have a coworker or a family member be there to say, hey, this is really stressful for me. I might need to take a step away. Maybe I need to leave early. Maybe I need to do some of my coping skills, such as meditation, before I go into a presentation or whatever it may be. How can I kind of alter the situations? And then finally, adapt. So how can I, come to terms with this is the situation I'm in? How can I maybe find a happy medium, a middle ground, knowing that there are going to be things in life, there are going to be people in life that we have to learn how to deal with, but there's ways that we can have our needs met and also meet the needs of the situation or the person by coming to a middle ground there, so adapting with that. So those are the 4 A's to kind of start your basis of how to evaluate stress management. But now I'm going to go into some more tangible things that you can implement, as a preventative measure, but also when you're going through stress, things that might help you with that. So we're going to walk through how we can practice self-care, how we can make sure that we're staying mindful, the concept of name it to tame it, and then how we can seek out that professional guidance and support when we need it. So the first thing we're going to dive into is self-care, and that is a hot button word when it comes to the mental health world, but there's a reason for that, right? Self-care is so important. And again, self-care is not just for your mental health, it's for your physical, it's the holistic body approach. And that's why we break down what are the different aspects of self-care. We have our physical self-care, so that's just taking care of our body, making sure that we're eating foods that are good for us, that are fueling us, that we are moving our bodies, staying active, that we're getting enough sleep. I always say with this one, we want to look at Maslow's hierarchy of needs and meet those basic needs. Make sure that those are being met before we can move on to anything else. Then we look at psychological self-care. And so this is really, are we taking time to be reflective and taking care of our inner self? And when we talk through mindfulness, this is going to come into play with psychological self-care. But that might look like, are we journaling? Are we doing hobbies or leisure activities that we enjoy? Are we taking a temperature check, doing some self-reflection for ourselves? Is that a part of our self-care routine? And then looking at emotional self-care. So this is really acknowledging and being there for our emotions. And so engaging in laughter, smiling when you're happy, and even expressing some of those negative emotions in the moment, leaving room for them. And that's where name it to tame it is going to come into place. Are we practicing that emotional self-care? And then the final level of self-care is spiritual self-care. And that's really just the care of the overall bigger picture around us, our spirit. And for some people, they might do spiritual self-care through praying, maybe some through meditation or mindfulness, and maybe others, it's just going on a walk on a nice day. Whatever that looks like for you, making sure that we are practicing self-care with a holistic mindset. So then we're going to go into mindfulness. And mindfulness is a practice that we can utilize when we are talking about our psychological self-care. It's a great in the moment thing. And with mindfulness, not only can you can use it as a preventative measure, but also in the moment when you're really experiencing stress, when you have that elevated heart rate, mindfulness helps to bring our heart rate down. It helps to calm us, and it can really help alleviate tension in those situations. Mindfulness is another one of those hot button words, but there's a reason for it because it's very important. But it doesn't need to be complicated, you guys. I always say mindfulness is really just being present in the moment and focusing on our five senses. So it's really easy to practice, and it could just be, paying attention to, how does this chair that I'm sitting in feel? How is my breath? What are the colors around me? What am I smelling? There are so many ways that you can practice mindfulness, both as a preventative measure, something that you just add into your routine, and then also in the moment when you're in a stressful situation.
I think what's so helpful with that too, Andrea, is it doesn't take a lot of time,
No.
especially to practice mindfulness. I think in the moment, if you're starting to feel, that anxious feeling, maybe your heart's starting to race a little bit, and you're like, okay, I just need to take a deep breath, focus on what's happening around me right now. I can't fix everything that's happening, days and days from now, but it's something you can do within a matter of seconds, and it can make a huge difference within the rest of your day just doing that.
100%, Jordan. It doesn't need to be complicated, so it's a great technique to use. And then moving on to name it to tame it. So I love this concept, and this goes into kind of that emotional self-care. And this was a term that was coined by Dr. Dan Siegel, and it really just talks about naming the emotion or the feeling that you're having in the moment to help alleviate the tension, the stress, the anxiety that's coming from that emotion. And so when we're experiencing, that significant tension and anxiety, when we just name that emotion, we can reduce the stress by 50% just by naming that state. But it does take practice, right? It does take practice to kind of know what our emotions are. So on this slide, we do have a feelings wheel for you guys, and this is a great resource to use if you're struggling to identify what emotion you're feeling. You can either look at the inner circle of the wheel if you maybe know that big emotion, but you need a little bit more detail of what's the more detailed thing I'm feeling. Or maybe you know a detailed feeling and you can't identify that larger emotion. You can go from out to in. But this can really help you to name that emotion and therefore lessen that stress in the moment.
Mm-hmm. Yeah, I know when we were preparing this presentation for you guys, we were talking through the feelings wheel, and I've actually used it before, to be honest. I sometimes have trouble naming emotions and exactly what I'm feeling. And I remember one time I was like, I just feel frustrated, but I can't figure out about why. Like I felt like that wasn't specific enough for what I was feeling. And then I kind of went down and found the word helpless. And I was like, oh, I feel helpless right now. Like I feel like I can't fix the situation. There were things that were happening I couldn't control. And then I was able to kind of speak to that and be like, okay, but I'm not completely helpless. Like I can do this, this, and this to address the situation, and then here are the things I can't control. It helped me to be able to do a little bit of good positive self-talk in the moment, which was helpful.
I love that. Yeah. I love that you were able to utilize it.
Yeah. And we also know that there are times where we are going to need to talk to our doctors, our primary care providers, and discuss, these mental health, physical health issues. I think something that was really positive that came out of 2020, I know there wasn't a ton of positive things, but I do want to say that one big thing was that doctors and primary care providers became much more accustomed to discussing mental health on an annual basis with their patients. It is not uncommon for you to go to the doctor for them to assess, are you feeling hopeless? Are you feeling depressed? Are you feeling anxious? And exactly kind of diving into that mental health and maybe any physical symptoms you're feeling. If you feel like you're having panic attacks, if you feel like you're starting to have heaviness on your chest when you get anxious, describing that to them as well, so then they can direct you towards the most appropriate care. And that can look like a therapist, that could look like a specialist who may need to put you on a medication for a short time just to kind of help out. It can look like a lot of different things.
Yeah, no, I agree with you, Jordan. And from my stance, that's what I always recommend as well. We want to make sure that we are ruling out any physical cause before we dive into that mental health treatment. And so the same thing, goes for what I recommend is to go to that primary care physician, let them know those physical symptoms, because as we know, they can mimic each other. Our physical and our mental can really mimic, especially as it relates to stress and anxiety and some of these heart conditions we're looking at.
Yeah.
So I completely agree with that.
Yeah, and we know there are some emergency situations too. So we've talked about preventative, we've talked about in the moment, and then we also know there are going to be some emergent situations that kind of look similar.
Sure.
Heart attacks and panic attacks can look very similar for individuals, and I want to make sure that you guys understand I am not a doctor. This is not overall medical advice. We just want to provide you with information and resources, maybe to just help better know your body or what to talk about with your doctor. So panic attacks often can occur when you are more at rest. They can kind of feel like they come on out of nowhere, and your hormones signal a fight or flight response. So you might feel kind of short of breath, or you might feel like your heart's kind of fluttering and a little faster. That can sometimes be a panic attack, and oftentimes it'll resolve over about 10 to 30 minutes or so. Whereas a heart attack are more likely to occur when you are doing an activity. Now, given there are some heart attacks that happen at rest, okay? So it can kind of be both, but it can have those similar symptoms of heart palpitations, that heart fluttering, shortness of breath, trouble breathing, jaw pain or arm pain. All of those things can be indicative of a heart attack. And these typically do not get better over time like a panic attack would. They get worse over time. Now, you're going to hear me say, if you are experiencing shortness of breath, if you are experiencing chest pain, make sure you are going to the ER and getting that assessed. We want you to be more safe than sorry in those important moments. And we've actually created, our Kinetic Health team is awesome and created a helpful resource that dives into how to know whether to go to an urgent care or whether to go to the ER. And so you'll see here on the ER column, it lists out some different reasons you would go to the ER. Shortness of breath and chest pain are going to be one of those things. So again, make sure you are getting those properly assessed if you feel like they come on. Again, like Andrea said, we want to rule out those physical causes first before we go into that mental health if it's in this emergent situation. I also kind of want to speak to mental health. If you're having suicidal thoughts or anything like that, again, make sure you're going to the ER and being seen sooner rather than later, because we want to assess those things quickly, right? Yes. So this is a resource we have on the Kinetic Health page. We can provide this for you after the presentation if you would like, and it is linked at the bottom of your screen. But that's kind of really all we have for you guys today, is to discuss that heart health and stress and how to better control things in the moment. So you can see me and Andrea have our contact information there. If you have any questions or concerns, feel free to shoot them our way. And we're going to hang out for just a couple more seconds, see if there are any questions coming in. And Kelsey, it looks like we may not be getting anything. So if you guys have any, feel free to email us and connect with us. But otherwise, we will see you next month for our next Kinetic Health webinar. Have a great afternoon.
Thanks, guys.